The House of Commons this evening defeated a Liberal motion calling on the government to make sure that initiative includes the full range of family planning, sexual and reproductive health options, including contraception. The government, which first said its G8 proposal would not include family planning, then reversed that position to say all options are on the table to help poor women in developing countries. But the opposition parties say the government isn't being clear with Canadians about its maternal health initiative and what plans it really has for how to roll this initiative out. And they say the government needs to be pinned down on this. Let's bring in our panel of MPs for more discussion on this topic. Joining me from the foyer of the House of Commons this evening, our Conservative MP, Candace Hepner. Keith Martin is a Liberal MP, a medical doctor who has worked extensively in the field of third world health. And Irene Matheson is the NDP critic on the status of women. Nice to see all of you. Thanks for being here this evening. Mr. Martin, let me start with you. We heard from Bev Oda, the minister. What is the purpose of the Liberal motion?
The purpose of the Liberal motion is to seek clarity from the government, Peter, on the issue of what the government's going to champion at this year's G8, G20 summit. The government's position before was to emphatically not support family planning, and now they've been quite vague in their statements, saying that we're not closing the door on anything. So what we're saying is that if you are in favor of human rights, if you are in favor of saving mothers' lives and children's lives and men's lives, you have to support the facts. You have to support the scientific evidence, which is to support many things, including a full array of family planning options. Okay, and that's what the Prime Minister signed on to last year.
All right. Does that full array of family planning options include, I guess the point is, does the Liberal motion imply support for abortion as part of the government's maternal and child health initiative?
It quite emphatically states that we support the full array of family planning options, including allowing women to access safe abortions in those countries where it is legal, because 63,000 women a year die of septic abortions, and many of those women's children also die. More than half of their children under the age of 5 will also perish.
So is the government right when it says that this is all about reopening the abortion debate and it doesn't want to go down that road?
Well, if you don't want to reopen the abortion debate, then allow women in developing countries to have the same rights as Canadian women. We don't want to reopen the abortion debate. Access to safe and effective safe abortions has been an established right from 1994 to now in those countries where it is legal. We're simply asking the government to simply support what Prime Minister Harper supported last year in Rome, and what has been the established policy for decades in Canada and around the world.
Irene Matheson, the NDP supports the Liberal motion. Do you understand it to be asking the government to include funding for abortion in its maternal health initiative? Dr. Martin says it is, but could the motion have been clearer?
Well, I think that the motion is indeed directing the government to live up to our obligations. And I think that the point is very salient in regard to the debate. The government, Minister Oda, raised this issue when she said in February that the G8 summit would not include abortion, access to safe abortion, and it would not include family planning. So she began the debate, she began the issue, she raised it in February, and the government has been backtracking on it ever since, because it's very clear the international community, all those agencies, NGOs that deliver services to women in the third world have said unequivocally that there must be family planning, there must be contraception, and there must be the availability of safe abortion.
Okay, let me go to Candace Hepner. Candace Hepner, how can you have this discussion about maternal health in the developing world if, as your colleagues say, the role of safe abortions is not included in the discussion? Don't you at some point have to reopen the abortion debate?
We absolutely do not want to. We refuse to open the abortion debate. Canadians don't want us to. What we did do, though, is we initiated a program where we could help women and children around the world who are dying. And the opposition have an opportunity to get on board. They obviously they're not clear on what they're doing. On Sunday, Bob Rae said this motion was not about abortion. Today we're hearing from opposition members members, all day we've been hearing it is about abortion. The government is not going to take the bait. We're not going to go down that route. We want to support women. There are 9 million children that die every year under the age of 5. There are 500,000 women dying in childbirth and pregnancy around the world. We want to help them. We want to provide food. We want to help provide safe access to clean water, medical care. That's what our focus is.
All right,
this is disappointing.
Let me revisit this question. The government and previous governments already, provide funding for International Planned Parenthood Federation. It supports a woman's right to safe abortion. So I guess the question really is, in the government's approach down the road here, the G8 approach for maternal health, is it going to continue that funding to agencies that provide either provide abortions or provide referrals or access to abortions in these developing countries?
Listen, we've been very clear. We want to work together with our GA partners on this initiative. We've been very clear that contraceptives will be part of the plan if that is what's healthy. That's what the scientific evidence says. But we don't want to focus on that. There's a lot of issues. For example, what about encouraging women in these third world countries to breastfeed their children? We know that babies and infants do so much better when they have their mother's milk. Things like that aren't coming up. Instead of talking about making sure women have a safe and an effective labor when they're having and delivering their babies, the opposition want to bring up the abortion debate.
No, but if the other G8 partners say, look, as part of this process of helping women in these developing countries, we think we need to continue funding access to safe abortions, or to create, in some cases, access to safe abortion. Is that something your government's going to support?
What we're going to do is work together with our G8 partners. We're taking a leadership role on this, but be very clear, we will not be taken off track. We will not take the bait. We will not get into the abortion debate. Canadians don't want it. We're not going there.
Okay. Mr. Martin, why have Liberals brought up the former U.S. administration of George W. Bush into the debate and the so-called gag rule that prohibited funding for international groups that perform abortions or help women abroad get abortions? President Obama reversed that policy. Why raise it in this motion?
Because the government has established a pattern or practice, Peter, where they've actually using ideology to trump medical science, whether it is withholding funding from International Planned Parenthood because they support women's rights to access safe abortions in those countries where it's legal. And I want to just address Candace's point that clean water and breastfeeding isn't going to help the 16-year-old girl who's been raped in the eastern Congo and needs to have an abortion because she wants that to save her life and that of her future. That's the reality in many countries, and we're simply trying to say to the government, follow the science. From the Partnership of Maternal and Child Health to the Society of Obstetricians and Gynecologists, the solution on the family planning side is very simple. Allow women to have the same rights as they do here. Allow them to have access to a full array of family planning options, including access to safe abortions where it is legal. Because as 63,000 women a year die, if you allow people to have access to family planning, you're going to reduce the number of abortions, reduce the number of women dying, reduce the number of children dying. So we don't know why the government is simply taking this very doctrinaire, ideological approach, which is really a medical problem.
Candace Hepner will have a chance to answer that in a second. But Irene Matheson, how concerned are you that the Maternal Health Care Initiative might exclude funding for organizations that perform abortions or refer women to have the procedures?
Well, I think that I am very concerned in as much as if you look at this government's record, it has cut funding to the Canadian Federation for Sexual Health without any explanation other than they're affiliated to Planned Parenthood, which is on the ground doing the work that assists women and their children. One of the things that hasn't been mentioned here, and I think it's salient to the discussion, is the issue around contraceptives in the form of condoms. In sub-Saharan Africa, we have millions of children, orphans, victims of HIV/AIDS. Their parents are gone. They're surviving in poverty because their mothers didn't have access to condoms to prevent the transference of the virus. And when Ms. Hepner talks about breastfeeding, yes, very important to breastfeed, but unless a mother has access to the security of a contraceptive, a condom, she's going to transmit the virus to her child when she breastfeeds.
That'll have to be our time tonight. Thank you all for taking part in this discussion. I appreciate it.
Thank you.
Thank you.